Because of COVID, this winter is going to be one of the most challenging our health services have ever faced. Before COVID arrived here, we had some of the longest waiting lists in Europe. Last winter, we had the highest trolley counts since records began. Elective care had to be suspended when COVID arrived here, so those waiting lists are now much higher. Right now, the number of people being treated for COVID in our hospitals is growing. And at the same time, infection prevention and control measures needed for COVID mean it takes longer and costs more to provide non-COVID services. COVID has created a perfect storm for healthcare. Higher demand for services, growing unmet and undiagnosed care needs, as well as a big reduction in service capacity. This winter plan is one of the ways we're going to navigate that storm. It's an investment of €600 million that builds on the incredible work already done right across the HSC this year. It starts and ends with the patient by supporting our healthcare workers. So what are we doing? We're accelerating sláinte care to fight COVID. That means keeping people in their homes and treating them in the community where previously they would have had to go to hospital. It includes nearly 5 million extra home care hours, access to diagnostics for GPs, 530 community beds, 631 rehabilitation beds, 57 community specialist teams, community assessment hubs, and additional support for the National Ambulance Service, which has been doing an incredible job this year. We're building up capacity in the hospital system too. It includes nearly 900 hospital beds, additional private hospital capacity, resources to triage COVID and non-COVID patients, more isolation rooms, extra resources for cancer services and other critical services, and several important e-health programs as well, including on national waiting lists. We're also building up public health capacity and protecting vulnerable groups. This includes community response teams, supports for nursing homes, homelessness initiatives, flu vaccinations, investment in infection prevention and control, occupational health and mental health. I want to finish by paying tribute to our healthcare workers, to our frontline workers, our nurses, our doctors, our allied health professionals, ambulance crews, hospital porters, cleaners, cooks, community therapists, GPs, swabbers, and everyone in between. And to everyone else in healthcare fighting COVID, our scientists, analysts, team managers, leaders, and so many more, many of whom have been instrumental in creating this winter plan. This winter is not going to be easy, but this year our healthcare workers have shown an extraordinary ability to respond, to adapt, to innovate, to make sure that everything that can be done for patients is being done. And I want to thank each and every one of them for all of the work they've done so far. I've no doubt that that professionalism and that determination will be seen as we implement this winter plan as well. Thank you.